see the questions pop up. In minutes, we will save for questions and answers. I'll start to track the questions and keep track. And if there's some common themes or issues, I'll try to synthesize those for the panelists. But I want to start out by, again, and we'll go in this order. We'll start with Kelly Underwood, Kelly Wofford, Dr. Underwood, and then Pastor Nicholas. And I'd just like to, I think we should probably start by defining some terms. So talk about, again, they're kind of becoming buzzwords, but I think it's important for people to understand exactly what we're talking about. So if you could kind of, again, after you introduce yourself, just talk a little bit about, what do we mean by health disparities and what are social determinants of health? So Kelly, if we could start with you.
Well, good morning, everyone. Thank you, John, for organizing this and blasting this out to the world. I am Kelly Marie Wooford. I am the founder of Front Seat Life. Front Seat Life is an organization dedicated to eliminating and breaking down the barriers associated with mental health and mental illness. I also lead the coalition for the Buffalo Center for Health Equity for Mental Health. So I'm the mental health lead of the coalition as well as communications. Are we doing intro first and then we're going to go back to definition?
Yeah, please. So yeah, so I guess Dr. Underwood, could you, and then Pastor Nicholas, just introductions and then answer the questions. Thanks.
Willie Underwood. I'm a clinician scientist and also social activist. I fellowship trained health services researcher for over 20 years. I've done research and looking at issues of health disparities, which are now termed as health equity. I also, sit on a couple boards, including the Population Health Commission Board, and also the board of the largest health insurance plan in the region, and as well as the American Medical Association.
Good morning, everyone. My name is Pastor George Nicholas. I have the honor and the privilege of being senior pastor at Lincoln Memorial United Methodist Church, where our mission is changing lives through love. I'm also in the chair of the Buffalo Center for Health Equity, one of the conveners of the African American, which started with the African American Health Disparities Task Force, but also we've evolved into calling it the African American Health Equity Task Force. And I'm also on the board of directors of Population Health Collaborative.
So I'm going to open it up, and why don't you, the three of the panelists, all unmute yourselves, because I'm hoping this will be kind of interactive, and I kind of encourage you to bounce off each other. I think that will be fun. But let's start with defining terms. So, and I know all three of you, and I know you're going to speak eloquently and brilliantly about this, but let's start with social determinants of health. It's kind of, again, it's becoming a buzz phrase. I'm not sure everyone understands what it means, and it would be helpful if we had a common understanding. Dr. Underwood, would you like to maybe take a first crack at that?
Yeah, I mean, I don't like making up definitions, so I'll just basically use the World Health Organization's definition. It's the condition in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of the daily life, including economic policies and systems and development of agendas, social norms, social policies, and political systems. Basically, is this. It's that the social determinants of health are all the factors that influence our ability to live in this country. Our economic status, our social status, our political status, how we're treated at work, how we live with our environment, all the things that impact us are totally considered the social determinants.
Ellie?
And so with that, the best way I've been able to frame that for people is when you look at my life. I'm 43 years old. I had a child at 18, at 20, and at 22. I am overweight. I have a master's degree. I get up and go to work every day. I have a wonderful family that is kind and caring and supportive and will do anything for anyone. And when you take all of that, all of those pieces of me and add social determinants of health on that, that equates to me living about 12 years less than white Kelly. So Kelly Marie Woodford, who's white, that has all those same, demographic pieces about her, but doesn't live in the same zip code that I'm in, will live 12 years longer than me, right? All things being equal, education, employment, my amazing health plan, all of that stuff, when you put it together, simply because of the color of my skin, which is where I was born, where I was raised, and all the laws, rules, and regulations that apply to everyone's life, I will live less than white me.
So, and one of the things that we have to recognize, and I'm glad, Dr. Underwood, you framed it from the context of the World Health Organization. And so when we talk about the social determinants of health, these aren't like opinions, right? So there's this whole conversation about what's going on in this country about systemic racism. And people are like trying to debate whether that exists or not. That's a reality. That's not like, well, listen, I don't agree that there's systemic racism. Well, if you don't agree with it, that doesn't mean it doesn't exist. I mean, and so the issues of the social determinants of health by any credible source that deals with public health, from international sources like the World Health Organization, for domestic sources like the Center for Disease Control, local community sources like the University of Buffalo School of Medicine, there is complete and 100% agreement that the social determinants of health is real. And it drives health outcomes. So we can park out of that whether or not I don't agree with that. Well, I mean, if you don't agree with that, there's not much we else can really tell you, because it's just we're dealing with the fact.
Yeah, it's like not agreeing that the world is round.
Right. And so the root of the social determinants of health, so I would push a little further, started in the 1600s, when African people were kidnapped and brought across the ocean and enslaved in the Western Hemisphere, or whatever they call. And from that moment, health disparities took place, even to the point of surviving the Middle Passage, right? And so those who were enslaved, their living conditions were worse than whites, their diet was worse than whites, their interaction with the criminal justice system, their access to education, the lived environment, all these things were significantly worse than the whites who were living in the community. And so from that moment, this gap began, this gap between blacks and whites in this republic. And to this day, many of these gaps still exist. And we've been able to document this from some of our work. We're here in Erie County. When we looked at 5 or 6 zip codes where like 80% of Black people live, we found that African Americans are 300% more likely to have chronic diseases. And what would those diseases be? Diabetes, heart disease, all kinds of things that just make you sick, right? Real sick. And so African Americans the prevalence of getting these diseases is much higher. And then we see that it translates to lost years of life. So 10 to 12 lost years of life. So just by virtue of your ethnicity, and I don't even like to use the word race anymore. We don't have time to deal with that. But by the virtue of your ethnicity and where you live, and it will shorten your life, and it will impact the quality of your life. So for example, amputations, right? If you're diabetic, I think you're about 7 or 8 times more likely, if you're African American, to lose a limb from amputation than if you're white. So it's not only the years of life, but the quality of the life that you're going to live. And these are facts. Yeah, Dr. Underwood.
No. I'm going to jump on the amputation thing. So it's not just that you get an amputation, not just that the sequela of the diabetes impacts your vessels more than it does whites, but it's also that you're less likely to be properly managed if you're Black with diabetes. And then when that diabetes progresses and it blocks your blood vessels, damages your micro blood vessels, you're less likely to get a bypass surgery around those vessels to save your limb. You're more likely to have an amputation instead. Those studies go back to the 1990s, where they looked at patients who were on Medicare, and we have seen that that continues. We keep repeating these studies over and over again. Also, dying from a heart attack. If you're Black and you have chest pain, I got chest pain, pressure on my chest, on my jaw, going down my left arm, and you go to the emergency room with the exact same symptoms as a white person, you're less likely to be treated like you're having a heart attack. Therefore, you're more likely to die from the heart attack compared to being white. So all these things layer on top of each other, right? So it's the social determinants, it's the constant discrimination that's going on, and all these things lead to Black people dying disproportionately to white with the same diseases.
So I want to bring us back a little bit, and I want to kind of give a little preamble. There have been a lot of conversations about racism, and a lot of these conversations have really bent over backwards to be comfortable, and frankly, really comfortable for white people, so that we're not having the hard conversations. So I'm going to share something that a lot of people say, and I want you to respond, because you talked about, Pastor Nicholas, racism going, starting with slavery in 1600s. I know a lot of really well-meaning white people who will say, well, that's over now, and we had a Black president, right? And you've probably heard this too, and I'm sure a lot of people think that. So I'd like you to talk a little bit, put racism not only from the historical context of slavery, but historically what's happened to our cultural, our economic, our all of our institutions, and how structural racism has been perpetuated and how it's leading to these outcomes, because that's kind of the real hard conversations that I don't think we have enough of.
Wow. Okay. So this webinar is 5 hours now. Not just one.
Right.
Well, right from the founding documents of this republic, where African people were deemed to be 3/5 of a person, so that just the undervaluing and just not looking at the full humanity of African people in this republic. And then, moving on through Plessy versus Ferguson, where, that the Black man did not have any rights that a white man should have to respect. And even when, I'm glad you brought up President Obama, and the fact that the night that he was elected, the white Republican Senate, who they have a moral and legal obligation to work with the executive branch. I mean, it's not like it's not like you have these choices, right? And they made this decision that no matter what this man did, they were not going to be supportive of him. And so these racist notions are just ingrained in the very fiber and the fabric of this nation, and in each and every institution is not. It's designed to benefit the majority community and not the minority community, and at times at the expense of the minority community. I mean, even following the Second World War, my father fought in the Second World War and the Korean War, but when he came back to America, he could not enjoy the same rights he's fighting for other people across the sea, right? He, being a Southerner, my mother being Southerners, they still had to endure the issues as it relates to Jim Crow and what have you, even after. So these things, and so they have a lasting impact. And the final thing about that is wealth. So most people, pass wealth from generation to generation. And so when you look at the wealth gap in America, what's interesting now in the year 2020, the wealth gap is actually increasing, right? It's not decreasing. So I think right now, for every dollar of wealth a Black person have, a white person has 18, right? And so that means, as it relates to issues of debt and young people going on to college, and accumulating debt. Very few of the people in the Black community have that uncle or grandfather or whatever that can say, here's 15, 20, $40,000. Those kinds of things, because there's not this ability to accumulate wealth, because one of your biggest assets that takes place in accumulating wealth, one is transfer from generation to generation, and the second is your home. Well, we know that a home, just by virtue of being in the Black community, will be valued at a lower rate than a white. So now you're not getting equity. There's I call it like a ghetto tax. I'm never in the ghetto, but the fact that if you live in the city of Buffalo or live in a Black community, your auto insurance is going to be higher. You're going to pay higher premiums on life insurance, all these other things. And all these things, what happens? They begin to drain your wealth. And then so many African Americans have negative experiences with the criminal justice system. And sometimes it's for unjust causes or whatever. But then you have to hire an attorney, and you got to do all this, that, the other. And it's usually grandma and grandpa from that other generation who has been able to save, because in that generation they would save. But now that money that they saved that they were going to pass on now has to go to attorney fees and things of that nature. These are the realities that go on in our community. Yeah.
But also, I want to make sure that we address the fact that, this is not a left-wing thing. This is not a right-wing thing. The system works the way it was built to. It's the same bird flying in the same sky, right? So this is not an issue of the last 4 years or the last 20 years. Right. This is not related to a specific party. The system works the way that it's supposed to. So we have to look at it from that perspective. Someone mentioned, policies and things that we can change. And I'd like to get into that a little more, but I think we need to hone in on how deep this really is. Most people don't understand that until last year, I believe in New York State, I could be not hired or fired because of how my hair grows out of my head, right? I have kinky, coily hair, and I can't comb it unless it's wet with conditioner in it. Because of how God made me, I can lose my job because my hair is not straight. So let's just say, we're all enlightened and woke and we accept people with their kinky, coily hair. But then I come to work and people want to touch my hair. I'm no one's pet, right? Oh, it's so beautiful. Can I touch it? I don't ask to touch your straight hair. So you don't need to ask to touch my kinky hair. Well, how does it grow? What do you do to it? It grows. I comb it when it's wet with conditioner, right? That has nothing to do with my job. So we have to look at really the environment in which we live, in which we work, and that's stressful. I can't wear purple hair to work, but my white counterparts can wear purple hair, and even though it may not be deemed unprofessional, they'll just say she's so artsy. But right. Kelly's ghetto. She's hood. Right. She's an angry Black woman. She has something to prove. Like, we really have to look at our personal, going back to that well-meaning white person, kind of lens. We have to go back to the things that we just inherently assume about people. Me having purple hair, I have tattoos. I don't show my tattoos at work because it's considered unprofessional. But there are folks with tattoos up their arms, on their feet, on their necks, and it's brushed off. So that is racism. That is a racist mindset, and it has nothing to do with feeling. And I think we need to get past looking at racist thought processes and racist actions as hatred issues, right? These are just ways of thinking without really putting thought into it.
So wow. I mean, you touched on, both of you have touched on so many points. I'm gonna see what I can sort of weave this all together a little bit. So, when we think about it, continuing wealth that's being siphoned off, we know that if a community gets more than 7% Black, the value of that community goes down, regardless of the professions of those Black people. okay? Period. Right. So now, that's true. So, and multiple studies, we've looked at this, it's been published, it's been said everywhere. Some of the comments that you said, I sort of laughed because these are some of the same things that I experienced as a medical student and as a physician. As a medical student, I would say all the time, I pity for my people that you will be taking care of them because I know how you treat me. And I can only imagine how you're going to treat them, right? Now, we look at this and we say, wait a minute, I'm not a bad person. I say, no, you're not. You're just a person who's become the person that you were trained and developed to become, right? People feel things, think things, say things because they think they're right.
Yeah.
There's something I used to say at work in my previous job, which I can't talk about. Just because they say it, that doesn't make it true. Just because they said, right? So 2 Black employees are shaking hands. One of the employees, another employee, white employee says, my husband is a state trooper. And he said that the only reason Black people shake hands is to sell drugs to one another. So now this institution implements an investigation against these 2 employees because there must be selling drugs. Okay. Now, once they find out that is not true, and matter of fact, the 2 people accused didn't even like each other, didn't even talk to each other, let alone shake hands with each other. Okay. That white employee maintained her job. So imagine you work with her and she now accused you of being a drug dealer when you're a family man trying to take care of your family. And guess what? She's your supervisor. Okay. And then you say there's no racism here, right? There's no racism here, right? Black people go to work and they're terrorized at work with no recourse. Because as soon as you speak up, as soon as you say, you know, I don't like the fact that you touch my hair, I don't really feel comfortable with that. They say, oh no, what's wrong with you?
Right.
Yeah.
What is wrong with you? And you are not a team player.
Right.
Yeah.
We don't understand how come you just can ignore the terrorism at work.
Right.
Right. So then guess what? So I'm gonna close this with a story. I had a conversation with my daughter about 2 pieces of pizza that I ate at night. And that she was somewhat upset that I ate these pieces of pizza. Now, of course, I'm thinking, I bought the pizza. What are you talking about? Right? You know, it's my money. But I looked at that exchange, and in the end, we had a conversation about power dynamics.
Mm.
Okay, now, and afterwards, I couldn't sleep that night. And the reason I couldn't sleep, because I had a lesson about power dynamics from my 12-year-old child, which was great, okay? But also I thought, what if I was in a hostile work environment and I came home and she said, Daddy, why did you eat those pieces of pizza? And I would have exploded, right? Not because of 2 pieces of pizza, because of all the stuff that I've dealt with. I'd have said, wait a minute, I'm busting my butt. I got to deal with this crap at work and come home when you're talking about some freaking pizza, right? See, and then she doesn't know while I'm doing that. So these things have long-term implications for generations. And I know it's great we had a Black president. I know it's great we got a Black mayor. I know it's great we got a Black police chief. I know it's great we got a head of the Black city council in Buffalo, right? But Buffalo is 1950 Mississippi.
And they were raised in the same system as everybody else, right? So they were raised in the same schools. They were raised in the same communities. So they were raised in the same racist environment that everybody else has been raised in, right? So you have to do personal work to understand what's happening. It's not taught in schools. I remember a woman, a friend of mine, I posted about Juneteenth a few years ago, and she's like, I've never heard of this. I was an education major in college, and I didn't learn about Juneteenth. And that is typical, right? But she was angry, frustrated, astounded right? That the system that she poured herself into to be able to then pour into young people mistaught her, right? So we have to get past, really, this is not about pointing the finger. This is about taking responsibility for who you are, right? And being able to pour into yourself. Like the three of us are, we're here because we believe in this issue, right? Because we're called to address this issue. But every Black person that you know is not gonna sit down and have this kind of conversation with you, nor should we have to. I'm a victim survivor of childhood sexual abuse. It is not my responsibility as a survivor to then go and teach my abuser how to not be an abuser, right? So we have to consider, just like it is not the responsibility of a victim or survivor of domestic violence to go back and teach that individual how to not be who they are, raised, born, studied, learned, whatever, however they got to that place. It is not that victim's responsibility. So I encourage everyone to pick up a book, like take this as a start, right?
Mhm.
But we have to do the personal work ourselves, not just white folks, Black folks, Asian, Latinx, everyone. We were all raised in this system. So it affects us one way or another.
And Kelly, I'm so glad you said that, because I think the importance of these uncomfortable conversations, right, is absolutely crucial. And we've never had these before. So, and speaking on behalf of, a lot of people I know, white people say, I'm not racist. And maybe they are, maybe they aren't, but very few people are going to come right out and say they are racist. But for those people who claim not to be racist, what does that mean for them? And what's the personal call, and what should they do? Because I think, and I know this for a fact, there are a lot of, and it's not a popular phrase, but I'm going to use it because we have to be uncomfortable, well-meaning white people who feel paralyzed, they feel stuck, and they want to do something. By golly, we've got to do something, and this is the moment, but they're not sure what. And a lot of people I know will say, let me go talk to some of my African-American friends and, see what they, right?
Right.
I mean, it's kind of it's a natural response. People want to help, people want to do something, but there's a level of people don't know what they don't know. So I think the conversation, the mix of the personal, because I know a lot of white people don't understand what it's like to be an African American in 20th century, 21st century United States from a day-to-day standpoint, how the systems, how structures, how cultures get in a way of a quality of life for them. And health outcomes is part of it, but there's a lot of other things. So I guess, I'd like to talk about this from both the personal perspective, because this webinar is about personal stories, because people need to hear these stories, but also the systems, the cultures, the policies, all that are put in the way. Dr. Hunter, would you think you want to? Yeah.
Yeah. So from a personal perspective, there's a couple things. Number one is that the conversations behind closed doors, you have to be an anti-racist, right? Anti-racist, right? You have to shut those conversations down or challenge them to the point that people begin to question what they're saying. I know there was interesting studies where in college students where they said, oh, if you heard Johnny say this, you would have thought he was a racist, but it was just really a joke. No, as a man thinketh in his heart, so shall he be, in his heart. So if I'm saying something, right, that means I'm thinking something. And that means that in subtle ways, I am acting on those thoughts, right? The exact same way. So now you sort of ask yourself, well, I have a fellowship, and I've had 33 physical therapists come through. I'm gonna say I had a physical therapy fellowship, and none of them have been Black. Why not? You mean to tell me there aren't any Black people out there who would love to come to my fellowship? Let me find out why. Let's look at our policies and practices. So a police department, local police department, Cheektowaga Police Department, how you say their name, they were recently, a few years ago, looking at the fact they're Black and police officers, and the police chief said, well, we have standards, here's our qualifications, this and the other. And I'm watching this thing, and my response was this: well, let's pull out your last hires for the last 5 or 10 years and let's see how they meet those standards. Because what I've seen is that standards only apply to certain people. They apply when you want them to apply, right? I've been in a room where people have outstanding qualifications and they search for one little thing that they don't have, and they make that the most important thing, right? That happens on grants and NIH. NIH did the studies and showed this, in which they're trying to change. It showed in hiring practices to the point that if you are a white felon, you have a 25% greater chance of getting a job over a Black person who's not a felon.
Right.
I'll repeat that. White felon has a 25% chance more of getting a job than a Black person who's not a felon, right? Now, here's the question. Is this so ingrained that there's no hope? There's always hope, but we have to be consciously fixing it. We have to say enough is enough. As Mother would say, too much stinks. And we're going to actively change this. Now, here's the interesting thing. No one policy fits all, right? As we're talking about choke codes and all this kind of stuff, that's just a distraction, right? Because guess what? When police officers use police dogs, they're more likely. There was a study in LA Police Department, and they looked at maulings of police by police dogs. And they looked at 1,000 maulings, okay, where the dogs were allowed to rip skin off of these so-called assailants, right? Only one of them was white. One, right? So how you use police dogs, how you use the billy club, how you use the chokehold, it's not the technique. It's when and how the technique is used and how it's overused on certain people.
Right. So one of the things, thanks, Dr. Underwood, Kelly, I mean, you guys have been just fantastic in the things that you've been sharing. Let me just kind of, two of our white brothers and sisters, kind of share real quickly just about the personal work that I still have to do. And it starts kind of doing with that work. Being a Black male pastor, there is so much in the terms of community of Black clergy, so much sexism and homophobia. It's just, it's heartbreaking. And so I have to do my work, but I'm surrounded by that. So it's easy to fall into that, and easy to just remain silent or dismiss it as being, well, that's just the way people were brought up and all that. Right is right and wrong is wrong, right? And so if you're going to be a person who is going to stand for what you believe is right, you have to do that in all situations and all circumstances. I can't be hypocritical and advocate for the rights of Black folks but also be part of a community that suppresses the rights of women.
Right.
Right. And so so there's this, so there has to be some intentionality on my part, right, to be an ally, and to, when I see things that are not, that are sexist and misogynist, to not slough it off that just that's the way things are being, but to speak on it. We had a revival at our church, and I'm not trying to get brownie points, and I was very intentional about having all women pastors preach and during the revival. So there's that, because oftentimes there's not those invitations that are given, you know what I mean? And so so how do I relate to what the issue of race? That to be an anti-racist is to not be silent in the midst of the systemic racism that you personally might not feel. I personally don't have animus to the gay and lesbian community. I personally don't have this sense of being patriarchal. But just because I don't personally have it doesn't mean it doesn't exist in the world in which they're operating in. And so you have to be an advocate. You have to speak up. You have to speak in spaces where people in marginalized communities will not be heard. And so the real work is to recognize and acknowledge that the existence of this systemic thing we call racism exists in the world in which we live, the places where you work, the churches that you go to, all these other things that's there, and that you have to play a role into trying to transform that space by your witness, by the way that you not only, it's not enough for you not to, in your own personal behavior, right? It's not enough to just be not racist yourself. It's what we're asking, inviting people is to recognize that racism exists within the system and that you are an ally, an advocate, that you recognize it, you see it when that Black person gets passed over for a promotion and you know that person was most qualified for that job, and you just don't sit there in your cubicle or sit there in your office and say to the Black person in quiet and isolation, oh, I'm sorry, you should have got that job, but you know how this company is, maybe you'll get the next one. No, we need you to go to that supervisor. We need you to go to management and say, I don't understand why this person was passed over for this promotion. Help me understand. If it wasn't race, then tell me as a part of this company, as part of this family, or whatever what it is. And that kind of advocate, somebody, I did see that that chat where somebody said, well, if it's so ingrained, can anything be changed? Yes, it can be changed. It can be, but it can't be changed by the advocacy of only Black people. It can be changed when Black folks advocate for themselves and then their white allies come shoulder to shoulder with them and push back against the system and identify and name it. Don't use these words, you know, all this stuff when you start talking about diversity and inclusion and all that, those are all words that kind of distract from the fact that racism exists. And so we need that kind of boldness. I know we don't have a lot of time, but that would help us.
And I love the word you used there, that you said you were intentional in bringing in, you know, the female pastors. And that's something that I think has been missing. And I think that word might be the difference between a non-racist or somebody who would describe themselves as non-racist and an anti-racist, right? It's more than I'm a nice person, I don't discriminate, right? And that's what a lot of us say, but that's not being anti-racist. So I'd like to kind of pick up on that theme and maybe ask all three of you, what's the difference between somebody who would describe themselves as non-racist and somebody who you would like to see really be anti-racist? And Pastor, I think you started that. I don't know if Kelly or Dr. Underwood, if you have more you'd like to pick up with.
So I would, that's a great question. I would separate or go the next level when we talk about allies, right? For me, an ally is a cheerleader. That is someone who is not racist, right? An accomplice is somebody that is willing to take whatever hit comes, right? I was there too. Yeah, I said it, I did it, right? We need accomplices. So cheerleading is nice. Kneeling is nice. An apology, nice words, right? But what work is actually being done to address those issues? Like, I don't need to see another picture of a company kneeling. That's nice, great. And, right? We have to get past, let's do this because it looks good, or let's do this because we don't know what else to do. So we're just gonna do something and then we'll keep it moving.
Yeah.
We have to be intentional. We have to be accomplices across the board. And we have to be okay with not being okay. Yeah. This is not an easy topic. It's not an easy issue to say, I was raised in a system that allowed me to believe I am better than Black people because I'm not Black. And that's more than being white, right? So that applies to, again, Asians, that applies to Latinx community, that apply. Nobody wants to be Black. Like, you ask anybody from anybody, if you could pick from these 5 backgrounds, would you want to be African American? Nah, nobody, right? Africans don't want to be African American. So we have to be able to look at it from that perspective. When you can look at a group of individuals and say, I wouldn't mind being born any one of those. I'm okay where I am and who I am and how I was made. But if I was, born in Mexico, I'd be okay with that. If I was Greek, I'd be okay with that. If I was Nigerian, I'd be okay with that. Right? That is anti-racism.
Yeah.
That's for me, that's what that means.
Good. That's good.
And Kelly, I just want to jump in real quick because I think, what you said, what all three of you said is really, really powerful stuff. And I think, frankly, this is the first time I remember having, at least in a public forum, a conversation that's this candid. I mean, you saying, and you, Dr. Underwood, you were laughing, but frankly, I was really struck. We said nobody would choose to be Black. That's really a disturbing thought. I mean, but nobody's going to argue with it. But I've just never heard it put so bluntly. And frankly, it's a wake up call. So
Can I just say one thing before we jump in there?
Yeah, please.
First
go
of all,
ahead.
before you jump in, Willie, I just want to say thank you because I'm watching the participants, and I want to say thank you for staying with us.
Correct.
Because this is progress, John. Because I fully believe this is my bias. So I'm like the Lord's still working on me. I felt that as soon as we started talking about race, the numbers of participants would start dropping.
Wow.
And people would just start signing off.
Yeah. Yeah.
So let me just say thank you to all of you who have been with us since 10 o'clock and are staying with us through this conversation. Yeah. Willie.
So I was trying to remember who it was, but it was a Black billionaire who was in a large auditorium who asked if there was anyone in the auditorium who would change places with him, who would become Black, right?
Wow.
And not a white person did, right? This dude's a billionaire. He said, I don't want to be Black. I don't even want to be a Black billionaire. Right? So because they know, and what he said was, because you know what happens to you, whether or not you are a billionaire or not. If you're Black, you're Black. And here's the interesting thing. Why is that? So let me tell you how that plays out in the classroom, right? So a Black child Black childs would throw spitballs and get accused of assault with a deadly weapon, get charged with assault with a deadly weapon, okay, and get convicted. Spitballs, right? So you think about it. So you're in a classroom and your teacher is looking across the room and she's trying to identify those students who are going to provide value to society in the future. And she's trying to develop them into that, right? But deep down inside, implicitly, she looks over certain sets of students because of who they are, not because of what they are, not because of who they are, right? So therefore, all of a sudden, the student who is trying to work hard, who's trying to do this, trying to get their questions answered, trying to do this, and all of a sudden, the white kid is having trouble, and teacher says, well, you don't worry about it, Johnny. Well, I'll work with you. Why don't you stay after class? I'll nurture you. It's okay. You can learn this. And the Black student, she says, well, maybe this is not just meant for you.
Yeah.
Right? Maybe this is just too hard for you.
Yeah.
Maybe we ought to lower your level a little bit because you can't seem to keep up with your peers, right? So then that student gets frustrated and he throws up over the desk, right? Because he's 10, 11, 14, 15, doesn't know how to say, doesn't understand why that person is doing that to them. Throws the chest over, next they're in the courtroom being prosecuted as a criminal, violent, kicked out of school, and this, that, and the other. And no one says to the teacher, wait a minute, you did what? I had a teacher tell my 8-year-old daughter, that's a pretty big book for an 8-year-old to be reading.
Yeah.
I'm like, what?
I know.
What?
You just think about it. You just think about too, because I know we only got about 14 minutes, and I want to get to some solutions. But just think about one of the conversations, and my boys will tell you. I remember one night, my boys go to great schools. I mean, we're really privileged in a lot of ways. But I challenged like the English professor, the English teacher, this is high school English, right? And looking at the syllabus, and that one book by a Black author. I've gone to my sons are musicians, and I've gone to recitals on jazz, the jazz lab, right? And no compositions of Black composers, right? And it's just the invisibility of our contributions in this culture is that contributes to this craziness that we're going through. So I think, you know, as we move into solutions, I know when people log on to these things, they want to hear some things about a path forward. And so I would say this: one of the paths forwards is making it a priority in this community to eliminate race-based health disparities. And so that in each of our spaces, that we recognize that in order to really be in full renaissance and resurgence in this region, we cannot have these data points where Black folks are so sick. And then to drill down and to really ask the questions, like, for example, we know that education is one of the social determinants of health, right? And we know that Black children, the Business First thing just came out, Black children are not, in Buffalo Public Schools, are not performing at the same level as white children in Williamsville, Lancaster, and what have you. Now we have to ask the question, what's going on inside the classroom and outside the classroom that's causing these educational achievement gaps? And then whatever those things may be, whatever they are, we have to make a commitment that we're going to fix that. And so what's happened, so what I would invite us to first, you know, and one of the things Population Health is going to do is try to provide some, working with the Health Equity Center, is really provide some guidance on these conversations to really explore why there are these disparities and what needs to take place in order to close the gaps. We know, I use this as an example all the time, you hear me, we know that the data shows that a Black child, if he just has one teacher that's Black in his educational experience, it has an exponentially positive impact upon his or her academic experience. So we know that this is, the data shows this. So what we have to do, one response would be, how do we get more Black teachers in the Buffalo Public Schools? Just a simple question. What is it that needs to happen? What do we need to do? I have some idea, but I don't know exactly what it is. But whatever we come up with, whatever we write down on that board, then we make a commitment, right, to do those things. So we have to so I want us to kind of tackle these issues as around the social determinants of health and health equity from a problem-solving perspective. How do you solve a problem, right? You can't solve a problem unless you recognize the root causes of what's creating the problem, right? Let me give you, if you give me 1 minute, I'm just going to say this because I'm going to give you some hope here. About 10 weeks ago, a group of us had a conversation with the county executive and the health commissioner and some other leaders. COVID-19 was coming into the region. We knew, because of the social determinants of health, and we already knew about diabetes, heart disease, and asthma were going to make people more vulnerable to COVID-19. We knew that there was a higher level of Black folks that have these diseases. And so we said to them, what's the plan for COVID-19 for the Black community? Well, they didn't have a plan. Okay, fine. We'll come up with a plan. We'll get right back to you. We came up with a plan. We reached out to our partners. We got people in the medical. We talked to folks. We just started moving. And we came up with a plan. We got some money for it. We implemented. Some people, we defined people's roles. Now, at that moment, 10 weeks ago, the fatality rate for COVID-19 was at 33% of Black folk. 33% of the deaths in the county were Black. That means it was 2.5 to 3 times higher than the population rate, which is about 14%. Nationally, all across this country, the fatality rate for COVID-19 is, for Black people are dying at 2.5 to 3 times more than their population rate in their communities. All across the country, everywhere, east, west, north, south, big cities, rural areas, that's where it shows. In Buffalo, Erie County, the place in which we live right now, because we worked together, we looked at the problem, we got folks together, we got Black, brown, white folks, institutions, grassroots people, we came together. As of right now, the fatality rate is at 16%, which is almost in alignment with the population. There is no other community in the United States of America that can say that. We can say that because we did the work.
Correct.
We did the work. So that shows us that there's a path forward to making some positive change. So I'm gonna stop now. I've talked enough. Got 8 minutes. Y'all can talk.
So if I could, I want to transition a couple of things. So we haven't solved racism in the 52 minutes we've been talking. So I do want to say, and I think this is important because there are so many things we haven't even touched on. There's phrases I hear all the time. One of my favorites is "I'm colorblind." At some point, we need to talk about that, right? Yeah. I also like the phrase, and it was from George Bush of all people, the soft bigotry of low expectations. And you talked about that in the context of your kids and, you know, the 8-year-old, why are you reading such a big book? So there are so many things that we need to talk about. So I'm committing now, this will be a series. We will continue this conversation. I'm not sure if it will be the three of you or we'll bring on other people, but it needs to keep going. I'm gonna kind of get off now with a couple of questions kind of related. First of all, I want to ask you all, what's your sense of hope? Are you feeling hopeful? Is this a moment where we can turn the needle? And Pastor Nicholas kind of addressed that. And I also want to ask, so I'm going to break kind of something that we said we wouldn't do, but I'm going to do it as a white guy. There are 88 people on this now. It's actually gone up. But there's 88 people on this webinar right now.
89.
Okay. What can we 89 people do? So you know, changing the school system is one thing, but on a daily practice, you know, in our own organizations, in our own lives, because and maybe there's not an answer to this, I'll be honest, but we want to feel like we're part of the solution, constantly starting tomorrow, doing something. And whether that means educating ourselves, reading more books, whatever. But if you could just address those to some extent, you know, are you hopeful? And what can the 89 of us do on a regular basis now to start to address this? And again, we'll commit to continuing this conversation for the foreseeable future.
I'm going to just say this. I'm extremely hopeful. And it's interesting because what gives me hope when I see people standing up, right, in protest, that's what gives me hope. That means that I don't have to die in silence, okay? So now what can each individual do? I think it's one is self-perspective. Let's think about you and not about you bad or good or whatever, but just say, wait a minute, am I contributing to this unknowingly or knowingly, right? So therefore, you know, I made some suggestions in the chat on 2 books to start, but those are just 2 books to start. And then start to have a conversation and ask your friends and your families and your coworkers, okay, right? Coworkers, right? Teachers, whatever. So then when you start to see things at work from a different perspective, in your home, in your neighborhood from a different perspective, or something comes up inside of you, you may say, wait a minute, why do I feel this way? Why do I feel threatened because this guy is walking down the street? He looks like he's jogging. He looks like he's minding his own business. Why am I now feel uncomfortable with this situation? And what does that say about how I've been taught? Not about me as a person, but how I've been taught. And how am I experiencing this outwardly in other ways that I may not understand?
You know, I think it's important to be able to see another person's perspective. Right? So, and this is answering your question. You know, at the outset of the conversation today, both Pastor George and Dr. Underwood gave statistics from very reputable sources. You know, it wasn't, you know, TMZ, who actually has very accurate information, but, you know, scientific, data-driven, you know, policy and politics agnostic organizations. that are saying these are the facts, right? So my suggestion to people is, if you don't understand, you don't have to agree, right? But if you don't understand how these numbers came to be, figure it out. Read a book, watch a movie, Google, right? And if you read a book, watch a movie, or Google, not the help, you know what I'm saying? Like really something meaningful, and you still don't understand, then you need to read a movie or read a book, watch a movie, read an article. If it still doesn't make sense, you need to read something else, right? You have to watch something else. It's not easy work. Now, some people may sit on this, webinar and be like, I get it, right? Others may be like, I still don't understand. We're all created equal. This is it. This can't be true. You need to go watch something, read something. There is work that you have to do to be able to understand that point. I understand why people voted for the person that's in office right now, right? I can justify that from many different perspectives. That is a gift from God. I'm not saying that everybody needs to be able to understand it at that level, but we have to be able to understand how we got here. And how we got here from Kelly may be different than how Willie got here, than how George, John, how everyone as individuals gets to understand and see how this works, right? There's a business line, there is a health line, there is a medical perspective, there is a religious perspective, like whatever lens it is you need to put on for that to start to make sense, then that's what you need to do.
If you look at the New York Times top 10 best-selling list for the past week, I think 9 of the books were related to race and racism. And so there's a lot of literature out there. Let me just speak real 20 seconds as a theologian and as a pastor. Our church is unapologetically Christian and unapologetically Afrocentric in terms of affirming, our roots. And what's interesting, of the last 10 or so people who have joined this church have been white people. And so what I want to encourage you, those in the faith community, maybe some white folks need to join Black churches and come under the leadership of a Black pastor who can help us grow. I mean, you want to do something radical, leave your comfort zone and come down and join a Black church and be part of what have your spiritual journey be in relationship and in collaboration with somebody that's not of your culture.
Yeah, that's terrific, and I love the fact that all 3 of you made this so personal. Not only your experiences, but what we have to do ourselves. It's easy to talk about them or that institution, and if only they would change, and they being whomever. We have to look inside first, right? I mean, we kind of have to do that introspective, hard work. Nancy, Pastor Nicholas is at Lincoln United Methodist Church, the corner of Maston and Main Street.
Yeah, and I wasn't trying to say join my church. You can, Nancy, come on down. But I'm just saying, so I don't want you to think that was self-serving. But I'm just saying, there's a large menu of places to come. But yeah, you're welcome. Everybody's welcome here.
276. There's 276 Black churches in Baltimore.
Yeah. So someday you can open. All right, it's 11 o'clock. So this has been terrific. The 3 have been fantastic. I'm so pleased that we've had so many participants as well. Do the work yourself. Stay tuned. We are absolutely going to continue this because I think these hard, uncomfortable conversations are what we need to have. So thank you all for joining us. It's been a pleasure. So keep in touch.
Thank you. Appreciate y'all. Bye.
Bye-bye.